Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Today we're talking about something that can truly save lives: preventive screenings. Many serious conditions such as cancer, diabetes, and heart disease do not show symptoms early on, and that's why routine screenings are so important. Joining us to talk about this is Dr. Siu Ming Geary. She is an internal medicine specialist with the Scripps Clinic Medical Group in Rancho Bernardo. Doctor, thanks so much for being with us.
It's a pleasure to be here, Susan.
So, what is primary care? Why is this the starting point for preventive health?
Having a primary care doctor is like having a partner in your healthcare journey. Your primary care doctor will be the person who knows you best, knows your medical history, your family history, your medical risk factors, and other personalized details that can help you customize the care on your preventive care journey so you can live a long, healthy life.
Many people only see a doctor when they're sick. Why is that approach risky?
Well, a lot of chronic conditions are asymptomatic until they're advanced. And so waiting until you're sick actually delays care and you lose an opportunity, a very valuable opportunity to prevent illness and again, live a long, healthy life.
So, how does the primary care physician help patients stay on track with recommended screenings?
So your primary care doctor will have a complete medical record of your medical conditions. They know your age, your gender, other risk factors, and can customize your risk screening, your cancer screening, your preventive care, and send you reminders when it's time to actually go and get that important mammogram or colonoscopy or any other test that you may need.
All right, so let's talk about these preventive screenings. Let's talk about diabetic retinal screening. What is it and why is it so important for patients with diabetes?
So diabetes affects the small blood vessels in the body, and if there are a lot of small blood vessels in the eye, and diabetes can cause a complication called diabetic retinopathy. And if diabetes is uncontrolled, it can lead to serious eye conditions such as blurriness, blind spots, even permanent loss of vision. And so getting that diabetic retinal screening can help detect those changes before they become a major problem and potentially treat them so that you can retain your vision.
And should that retinal exam just be once a year?
No, actually, if you have type 2 diabetes, we recommend you get screening upon diagnosis and then every year afterwards to detect changes. If you have type 1 diabetes, we usually recommend you get screened within the first 5 years of your diagnosis and then annually after that. And of course, if you have eye disease that's been diagnosed, then we recommend that you see your eye doctor much more regularly to treat that condition.
All right, let's talk about cervical cancer screening. Why is cervical cancer screening considered one of the most preventable cancer strategies?
Cervical cancer screening is really important because we can detect changes before cancer actually occurs. And so getting testing early can help prevent cervical cancer. And again, people who have cervical cancer may not have symptoms at an early stage. So getting that is very important for your health.
And as far as the testing goes, what's the difference between a Pap test and HPV testing?
The Pap test is actually testing for cells on the cervix, which may have early changes that indicate cervical cancer or actually cervical cancer itself, while the test for HPV, which stands for human papillomavirus, it's the virus that can cause the majority of cervical cancers. Testing for that can help identify your risk factors and lead to treatment that will prevent cervical cancer.
And at what age should screening begin, and how often should it be done?
So most guidelines recommend that cervical cancer screening start at age 21 to 25, and it depends on the guideline. But what we recommend is that starting at age 25, you actually have testing every 3 to 5 years. If you have the HPV test, it should be every 5 years. If you have the Pap test, it's every 3 years. However, your doctor, your primary care doctor, can help you decide which test and what screening frequency is best for you because it will depend on your history and other risk factors.
All right, let's talk about breast cancer screening. Why are routine mammograms so important, even if there are no symptoms?
Mammograms are really important for breast cancer screening because they can detect breast cancers up to 2 years before you can even feel a lump, and that's by you or your doctor. So again, combining that with regular visits to your doctor and getting that screening can help prevent serious disease.
When should women start breast cancer screening?
The current guidelines recommend that women at average risk should have breast cancer screening starting at age 40 or 45, depending on their personal risk factors, and have the mammogram every 1 to 2 years. Your screening schedule should be customized based on your medical history, your family history, and other risk factors based on discussion with your doctor.
And how does family history change screening recommendations? Let's say, your mom or your aunt had breast cancer.
That's a great question. If you have a close family member like your mother or sister or your daughter with breast cancer, that will change when we recommend you start getting screening for breast cancer. And if there are additional genetic risk factors, you may also need additional testing like an ultrasound or an MRI. So that should be customized based on, again, your medical history with discussion with your doctor.
Let's talk about colorectal cancer screening. Why has colorectal cancer screening become such an important conversation, even for younger adults?
So colon cancer, this is one of the success stories because a screening colonoscopy can actually prevent colon cancer, particularly if we can find what we call adenomatous polyps. These are polyps that can lead to cancer if not removed within the next 10 years. And what we're finding now is that cancers are showing up at an earlier age. In fact, men aged 20 to 49, it's the leading cause of cancer death. So getting a colonoscopy can potentially prevent cancer in addition to detecting it early.
And at what age should screening begin for, let's say, average risk patients? And what do you consider average risk?
Average risk are people who don't have a personal history of colon cancer or colon polyps, a family history of colon cancer. They don't have inflammatory bowel disease, and they don't have certain genetic risk factors, genetic conditions that might predispose them to having colon cancer. And screening typically, because we're seeing it at an early age, screening now starts at age 45.
And what about screening options? What kind of options are available?
And there are actually quite a few options for colon cancer screening. The most comprehensive is the colonoscopy, where they take a camera and they look in your entire colon and at the same time can remove polyps if they find any. There's also something called the FIT test, which is fecal immunochemical test. It actually looks for blood in the stool. You do that every 1 year. There's also something called Cologuard. It's a stool test that you can do every 3 years. Other options include flexible sigmoidoscopy or CT colonography.
And you're saying that colorectal cancer can actually be prevented through this early screening.
That's correct, because if we can detect and find these colon polyps, which are precancerous in nature, and remove them, then you've essentially removed the potential source of a future cancer.
All right, let's talk about hypertension control. Hypertension, also more commonly known as high blood pressure. Why is high blood pressure often called the silent killer?
It's called a silent killer because most people with high blood pressure don't feel any different. It really is asymptomatic until it becomes advanced or has done damage to your organs, and or it's extremely, extremely high or extremely low.
And what are the risks of uncontrolled hypertension, high blood pressure?
Uncontrolled blood pressure can do damage to the blood vessels in your body. And there are blood vessels in your eye, in your brain, in your heart, your kidneys. You can just think there are multiple organs that can be affected. And so long-term damage to those blood vessels can lead to stroke, heart attack, blindness, kidney failure. It can cause a lot of damage if uncontrolled. And thus the importance of getting screened. And if you're diagnosed with hypertension, having that treated early.
So, how often should your blood pressure be checked?
So if you do not have high blood pressure, we typically recommend getting it checked every 1 to 2 years, but it depends on your risk factors. So it's safe to get it checked every year or talk to your doctor. But once you are diagnosed with high blood pressure, if it's well controlled, typically every 1 to 2 or 3 months, it depends on how well controlled you are. But if it's not controlled or you're having medications managed or adjusted, then we will recommend more frequent testing. So having a home blood pressure monitor will be very useful in those cases.
All right, let's talk about diabetes A1C control. What is A1C? What does that A1C test measure?
The hemoglobin A1C, also known as A1C, is actually a measure of how well your blood sugar is controlled over the past 3 months. And for some people, it's synonymous with diabetes control. And we use that as a main tool to tell us if your diabetes is under control.
And why is A1C control so important for your long-term health?
So hemoglobin A1C control is synonymous with diabetes control. And if your A1C is at goal or at target, it means that your diabetes is also not out of control. Your blood sugar is in the target range, and you're much less likely to have the long-term complications of diabetes. And by that, we mean strokes, heart attacks, renal failure, eye disease, etc.
So how often should that A1C level be checked?
So if you have diabetes, we recommend that you have it checked about twice a year to ensure that it's controlled. But if it's not controlled or you have medications being adjusted, it may be checked more frequently.
And what would you say to somebody who is overdue for these preventive screenings?
It's never too late to get caught up. If you go and see your doctor, they will take into account your current health, your risk factors, and what screening tests that you may be due for, and can help you get scheduled and caught up very quickly. It's never too late.
And you can also check your preventive screenings history, right, on your My Scripps app.
Absolutely. As a Scripps patient, you can go to the My Scripps app, and there is a section for preventive care. You can look to see what you're due for, and in many cases, schedule directly from the app.
It's because it's the three lines in the upper left, right? Once you log in, and then you scroll down to what's called My Record, and then you click on preventive care. It's just all right there in front of you.
It is all right there.
Any final thoughts, doctor?
Just encourage everybody, if you have not already scheduled your preventive care with your doctor, pick up the phone, get on your app, make that appointment. It's not too late. We look forward to seeing you.
Doctor, thanks so much for taking the time to be with us. We appreciate it.
Thank you. It's a pleasure to be here.
If you want more information on preventive screenings, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.